Welcome back to Girl Talk. February is Children's Dental Month, and we have got one of my favorites, Dr. Amy Sargent here from Excellence in Dentistry. Thanks for coming.
Thanks for having me.
So, Dr. Sargent, you said that Children's Dental Health Month is coming up, and why is it so important for kids?
Well, it's important for everyone, but especially for kids, because I think there's lack of awareness that tooth decay is the second most common disease in the U.S. after the common cold.
Wow. I didn't know.
That's awful.
That's disgusting, yeah. But good to know.
Good to know, right.
So, how early does this happen, and what's related with tooth decay? How early can you tell that this is going on in children?
Well, surprisingly, we do see cavities in kids as young as 1 year old.
Wow.
1 year?
Right.
That's
How
crazy.
does that even happen?
Well, I think that one of the main things that can cause this is a high sugar diet. So
Sure.
a lot of juice. I wouldn't say that kids that are 1 are drinking soda, but certainly older kids are drinking soda, sports drinks, those kinds of things. And then the other thing would be kind of the lack of knowledge of how to care for a child's teeth.
Okay.
So why do you think, obviously it's an issue based on just the health issues, of course, but
Right.
why do you think it's an issue in terms of taking care of these problems?
Well, I think that the kind of the old guidelines that a lot of people still follow is to get the child to the dentist by the age of 3. So some of these problems we're seeing are occurring before the age of 3, so we're not even able to see that they are a problem. So we want to be sure people are aware that this is a problem that's happening. We need to get the kids in as early as possible.
Really? So really starting pretty much right away.
Right
How
away.
early do you think?
By the age of 1.
Wow. Okay.
Wow.
So this is you're born. We get you to the dentist. Let's go. Absolutely. But I mean, as soon as you have teeth, I suppose it
Right.
starts becoming oral hygiene is important.
Well,
Right.
It's the habit, I would imagine,
Right.
getting them used to properly cleaning their teeth.
Right.
So what happens if they have cavities? I mean, can you actually fix cavities when they're that young?
Yep, we do need to fix them. We definitely need to fix them because
They're baby
cavities.
teeth. Can't they just fall out?
Right, that's such a good question. We hear that a lot. No, we want to fix them so that they don't cause pain and infection, just like an adult cavity does.
Yeah.
A child's cavity can cause that as well. And even more importantly, they can't sometimes verbalize that they're having discomfort.
Right.
So we have to fix them. We also need to fix them because they're going to be in there for a while. Some of those teeth are going to be in the mouth till like 12.
So if they're crying and fussy and their tooth
They
hurts,
might-
don't give them more candy just to make
Don't
them
give them more
happy.
candy. Right. The other reason we want to be sure and fix them is we want to keep those teeth healthy to maintain what we call arch space, so that there's enough room for the permanent teeth to fit in there.
Oh, that makes sense.
Yep.
So what can we do? The parents, the teachers, other health providers, what can they be doing?
Well, I think one thing we want the healthcare providers to do specifically is to be sure they're encouraging parents to get their child to the dentist in a timely manner. So we want to say by 1. We want the children to be very comfortable in the dental office. We want it to be very routine for them. We don't want it to be anything scary. It shouldn't be.
Makes sense.
Yeah, we want it to be as routine as going to the pediatrician.
Sure.
So that if they do need treatment, they're not fearful. And this is just a happy place to go where everybody's nice and taking care of them.
And I think probably establishing that habit and getting them used to being there too.
Right.
It's just something that's part of their routine
Right.
from really when they can remember.
Yep.
So do you think that's the take-home message here, or what's really
Yep.
the message to help keep kids' teeth healthy through life?
So the first thing is awareness, which is what we're trying to do right now, make everybody aware that it's a problem. Once you're aware, you can take steps to remedy the problem. The next thing is assistance. I didn't mention this earlier, but what I want to mention is that as most people know, kids don't have really great dexterity, even until about kindergarten, so they're really not going to be the best brushers. So we want parents to be helping the children brush until they're really getting in there really well and getting things clean. The next thing is following a low sugar diet. Certainly nobody needs a bunch of sugar, especially on their teeth.
Right. There's multiple health reasons
Exactly.
there. Yeah.
Real
Yep.
quick, what kind of toothbrush should children be using? Soft, medium, hard? Does
Soft
it matter?
toothbrushes,
Soft?
yep, small children's toothbrushes. At a certain age, we start to give out spin brushes as well.
Sure.
Yep.
Cool. Well,
Yeah.
lots of great information. Who knew?
I didn't. Oh, that's really
So
fascinating.
get those kids in early, especially for February, which is Children's Dental Health Month. So thank you, Dr. Sargent, for coming on in.
Thank you.
We're going to be back with more Girl Talk, Orange Sheep Fitness, back in a moment.